and it will be available on YouTube at a later date, inshallah. So thank you all for joining today. My name is Jamilla, and I will be hosting this webinar. And I'm just going to allow the panel to introduce themselves, inshallah. So we'll start with Sheikh Saeed.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome everyone. My name is Saeed Nasser. I'm a counsellor and a clinical supervisor. I'm here today representing the Muslim Counselor and Psychotherapist Network. I also collaborate with other organizations such as Approachable Parenting, and I'm based in the Yemeni Community Association in Sandwell in West Bromwich.
That's great, thank you. Sister Faeeza.
Assalamu alaikum everyone. My name is Faeeza. I'm the Executive Director of the Muslim Women's Network UK. We run a helpline, which is a national helpline, which also has a counselling service which is offered. The callers can contact, or you can contact by other means as well, but often the issues range from mental health issues to abuse issues. So I'm sure we'll be speaking more about those today.
Great, thank you. Rehan?
Hi, my name is Rehan. I'm representing Sakoon. I am a therapist as well as being a project manager for Sakoon Counselling. Sakoon Counselling offer a wide range of services from accredited training courses if you want to become a fully qualified therapist. We offer individual, couple, teenager, family therapy, not just in the UK, but globally as well. Okay.
Great, great. Thank you. Taefur?
Assalamu alaikum. Can you hear me?
Yes, we can hear you.
Assalamu alaikum everyone. My name is Taefur Rahman. So I'm a qualified counsellor. Also, I'm a dietitian, and my background is basically counselling in the Muslim community, predominantly in the Bangladeshi community. So I'm based in the heart of the Bangladeshi community in East London. And currently I'm representing and working with Mindworks UK, which is a multicultural counselling service. Thank you.
That's great, thank you. And Brother Omer.
Assalamu alaikum warahmatullah. My name is Dr. Omer Moghraby. I am a consultant child psychiatrist in Southeast London, and I deal with young people up to the age of 18 or so, although I have worked with adults in the past, and I provide some supervisionary support to counsellors working in my local community.
That's great, thank you, and thank you all the panelists for joining today. So just to remind everyone, please do post any questions you have in the chat, and we'll also be sharing resources where you can get help if you are experiencing suicidal thoughts, and for more information on suicide prevention, as well as the resources of all the panelists today. So to start off, we've had one question in, which asks, why do people have thoughts of suicide? Rehan from Sakoon Counselling, what are your thoughts?
Yeah, of course. I mean, suicidal thoughts are really the result of feelings like you can't cope, okay, when you're faced with what can be seen, and I say seen, as to be overwhelming life situations, okay, and you don't have any hope for the future, and you think suicide is the only way out, okay. Now, the causes are varied, okay. One of them being mental health concerns, others you got being isolated, especially during COVID, money problems, abuse, bullying, LGBT. Now, the statistics on the recently, which I was found on Samaritans, is that the male suicide rate has increased by twofold in the last 2 decades. Okay, they didn't specifically associate that with COVID, but they say it has increased since obviously COVID had kind of started. Now, some of those reasons could be, which I've mentioned, the causes, okay, which is money problems. Most people are actually losing their jobs as well, okay? And men are more likely to actually commit suicide than the kind of female counterparts, okay? And the reasons for those is, again, varied. Males are less likely to talk about the feelings and what's going on for them compared to females, which will seek counselling, other forms of therapy. So that's just an overview in terms of why or what the causes are. It is varied. The other thing that we need to consider when you're on antidepressants, if you read the back of antidepressants, it does state that if there is more tendency or increase in suicidal thoughts, is to go back to speak to the GP where they can decrease also the antidepressants. The highest rate of suicide is within the LGBT community as well. You know, I'll leave that open and we can talk about that a bit more, why the reasons are, but I will leave it open as well if you've got any questions.
Yeah.
Just to add the kind of the quote from the Quran before we do go into it. Now, Allah clearly states that He does not give you a burden that you are unable to bear as well.
Would anyone else like to come in on that? So why do suicidal thoughts exist? I mean, you've raised a lot of good points, especially due to COVID and the increase of coronavirus. And also, you know, recent studies have suggested that men are more likely to take their own lives than women. I think one statistic I looked at was the rates are 75% men to 25% women. Are there any particular reasonings behind why it might be more likely for a man to lose their life from suicide? Dr. Omer, do you want to come in?
Yeah, no, I just wanted to pick up on a point that the brother made about suicide. I mean, I agree entirely with what he has said. But I suppose the fundamental things, we don't really know why people come up with any thoughts. And I think it's probably not best to attribute those to any one source. So it just, I think the way I've certainly explained it to some people is just another way of managing your stress. It could be many different ways for other people. For some people might get very angry, and others just might go down that route to think that life is not worth living. I'd be better off dead. No one would miss me. You know, then I get to these. Then you get down to these sort of suicidal thoughts, a sort of tendency towards that sort of pattern. And I would say that treatment for depression, which is probably the commonest cause, but not universally by any means, may involve things which make things slightly worse. So it might be very difficult at the start of it, and that includes antidepressants. And so just to be aware that if suicidal thoughts increase, it's definitely worth talking to your GP or whoever's prescribed it, your psychiatrist, about it, and just a note of caution around the particular drug antidepressants such as the SSRIs, which can increase it according to the research, at least, in those for whom suicidal thoughts are prominent before you take it, so you're more likely to get it. And the peak of the suicidal thoughts is around the time at which you cash in your prescription, so to speak, and then 4 weeks later. There is a noticeable decrease before and after that point. So those are sort of really crucial aspects. It's not a universal thing, and increasing and decreasing doses may or may not have an effect on that, or stopping it. It still may not be the right drug. I just thought it'd be important, just in case anyone thinks they would want to stop it or not stop it. The other area I would say is really important is communication. It's well known, I think, for a long time, that male and female have different rates, but they also have different rates depending on the age as well. With males being much higher towards the middle of life, towards the end, and then females picking up, and also higher rates of females in the much younger age group. Part of that may be around communication, access, and talking. In the serious case reviews, which is a review which are often commissioned by local authorities when there is a suicide, often of young people, everyone I've seen talks about the lack of communication, whether it's between parents and young person, or the person who committed suicide and the local community. Lack of engagement. It's not necessarily the access to treatment, it's just how they engage with everything. So I think the biggest thing is to encourage people to talk about these issues, and just to mention suicide doesn't make it more or less likely.
Great, thank you. So definitely when people are thinking about medication or things like that, to keep that line of communication open with their GP and their doctors. Yeah, I think Sister Faeeza, did you want to come in?
Yeah, I just wanted to reiterate what Omer said about, the reasons. There's no set reasons. Ultimately, suicidal thoughts often happen as a result of feeling like completely unable to cope with a particular situation. And I think we've had some examples of situations, and feeling, that this is the only option left. And that's why I think, speaking about it is so important.
Yes, definitely. I think, that there's been perhaps an increase of situations that have been more difficult to cope with over the last year, and that's why talking about things, and this webinar especially, is important to raise awareness of suicidal thoughts.
Just adding to that, Jamilla, I think it's really important that mental health is still a very taboo subject in our community. And often people feel they're going to be stigmatized if they start opening up or talking about things, or especially, the statistics seem to suggest that men are more likely or affected or afflicted by it, because often it's seen as, when people talk, seen a sign of weakness. And that's not really, from when we think about Islamically, that we are encouraged to talk about our emotions and feelings, to talk about the things that cause us pain and heartache. The Prophet ﷺ, when he lost his son Ibrahim, he said, the eyes become tearful and the heart becomes sad. And we only say what is pleasing to our Lord, to Allah we belong, unto him we shall return. O Ibrahim, we are saddened by your departure. And also, talking about emotions and feelings doesn't make us weak or make us, bad. Prophet Yaqub alayhi salam, he cried for the loss of Yusuf until he lost his eyesight. It didn't mean that he was a weak prophet. No, peace be upon him. He was one of the noble prophets that Allah subhanahu wa ta'ala, sent to humanity. But he still had those human feelings. He still had those, things that he needed to express. And when he didn't express it in kind of to others, it became a physical thing where he lost his sight.
Yeah. Thank you, Saeed. So we've had another question in. I worry about my grandfather. Since my grandmother passed away, he has been less active and is very sad. He isn't eating much and doesn't talk to us much. How do I ask him if he is having suicidal thoughts? How do I help him? He is a Bangladeshi and I don't think he'll ever admit to feeling depressed, and I don't even know the word for suicide in Bengali. Taefur, you said you work a lot with the Bengali community in East London. Perhaps this is something you can come in on.
Sure. So just the question, it's broad. So the question was mentioned that he's not eating. Also, he's how does she know that is he having suicidal thoughts? Well, first thing first, it all depends on the level of grief. I mean, how long has it been? What's the process? So if we follow the grief model, so you've got the model of the grief model, and from the grief model, you've got the stages. So if, just say argument's sake, her grandfather is on the depression side of things, not eating well, he's not sleeping well, how does she communicate? So what happens with a lot of South Asian men in general, and it's predominantly in the Indian subcontinent, we suppress a lot of our anger, our emotions, our frustration, and then we kind of shut down. So it depends on all sorts of factors here. So the best form would be to keep things light and basically perhaps talk about good feelings, talk about the memories, talk about good times, and then slowly try to open up a dialogue with the grandfather. And then also maybe take him for a walk and just slowly then try and see if they can build a connection from there, because it feels that if he is not eating well, then that's going to also have an effect on the mental well-being. So there's quite a few factors here, so it's going to need to be broken down. And to answer it in a short context, if they follow the grief model procedure, there's about 5 models in the grief model procedure, that will then give the person a rough idea on what the stages their grandfather is at.
That's helpful. And is there anything, you know, people should do differently when talking to an older person about their mental health? Have you come across maybe ways that would work differently compared to speaking with a younger person? Are there kind of different attitudes?
Yes. So with the older person, so language is a key here. So language, so with an elder person, again, let's use the South Asian community, English is not the first language. So if English is not the first language, to try to communicate with them in the language area, that can be another burden on the person. So it all depends on the person and their ability to be able to communicate with the person. So with South Asian people, they love talking their native language. So, and that's where they best express themselves. So perhaps maybe sometimes even getting an elder sort of person or a neighbor or somebody who can just kind of communicate with them. So that kind of works.
Yeah, thank you.
So I just to echo that unfortunately the death rate of a spouse is very, very high once one of them has passed. And I think it's important to recognize there may be something as simple as routines which have been lost. So I think finding something that is simple and a routine might be quite useful. And as the brother Taefur says, talking to someone along their age groups or thinking about it can be very, very helpful. I've certainly found with another elderly patient I had a few years ago, where just talking about something simple that he did, that is, his family found it too difficult. I mean, they just couldn't be bothered to talk about how things were back home and things like that. So it wasn't actually CBT or anything that was offered, but just finding him a route to talk and chat and to find out, just gave him a way to get through some of these aspects, as Brother Taefur said, to pass through that sort of grieving process and stage all the way through.
Thank you. And from discussions of older people to a question we've had in about a younger person. So the question is, my son has all the signs of depression. He's been seen by the GP, but it's on a long waiting list to see the CAMS team. What can I do to help him? What signs should I look for, or what should I ask that would indicate he is having suicidal thoughts? And I think this is the question perhaps a lot of parents of teenagers may have, kind of where's the line between, you know, depression and mental illness and just being a teenager, I guess. So Omer, over to you for that one, inshallah.
Yeah, I mean, I think I'd go back to the communication issue. Many of us who've had teenagers will know the sort of sign of teenagers is number one, saying they hate you, and number two, not talking to you at all for a little bit. So I think the lines of communication is really, really important. And I think where I've seen difficulties in my own caseloads of young people who've been suicidal, perhaps gone to A&E or whatever, it's that family breakdown of talking, finding someone else that they can talk to. It has to be you as their parents, if it is, and that can be difficult, and that's where professional help can be useful, or just finding a supportive voice that can be really helpful. And that's probably the number one area I would suggest, because young people are extremely resilient and have ways of managing, but if they just have nowhere else to cope, their world seems very, very small. Signs of depression are can be things like irritability, lack of sleep, too much sleep, not eating, not wanting to eat, changes in behavior. You'll know your children better than anyone else, and it's just that sort of change that you can't necessarily put your finger on will be something to note. But that doesn't necessarily mean that it's depression. There may be a number of other things going on. By opening up that channel of communication, you can then perhaps hear about the bullying in their life, or the fact that they think they don't look very good, or it could be anything that's worrying them. It's really sometimes it can seem quite trivial and silly, but it just escalates further and further.
Yeah.
And in the meantime, there could be places they can go to talk to, things like couth.com. There's a few other avenues they can talk about, and it may be their local CAM services have got things that they can do in the interim.
Yeah, that's
And
great.
can I just add to that, to
Yes,
what Brother Omer has said, and communication, as Brother Omer rightly mentioned, it is the key here. And one of the reasons, what I will say to parents is listen and not offer advice. Okay, listening is more powerful than actually offering advice. So when you're actually with your child, listening to them, it gives them the sense of empowerment, that they're in control. And when they're ready to listen, that's when you can go in and offer that advice. Okay, most of us don't actually, and parents don't spend actual physical time listening to what's going on with our children. And as Brother Omer mentioned, it is normally the breakdown and that breakdown of fabrication in family unit, which can cause suicidal tendencies. I talked about bullying quite early on. When I mean about bullying, it doesn't necessarily mean bullying at school. It also means bullying in the house. When you're constantly criticizing your child, not giving them positive feedback, they're going to give you a sense of this life is not worth living. Yeah. So I just want to mention that to yourself. Yeah.
Thank you so much. We've had, we've discussed a lot about communication, and we've had a question in, what can we change in the language used around suicide to reduce stigma? Sister Faeeza, can I come to you with that one?
Yeah, and I think we're all learning on this particular issue. I mean, the Muslim Women's Network UK has a resource online around mental health issues, which includes suicide and tries to challenge some of the stigma. But when we produced this, 4 years ago, 5 years ago, the language we used was committed suicide. So for me, that's one of the things we definitely need to change, because to say committed or commit suicide, there's a link between suicide and crime or sin, and that can be alienating for some people. So instead, I think we need to correct our language and use terms like died by suicide or has ended his or her own life. The other thing, you'll see this in the media sometimes, suicide epidemic, that should be avoided. We shouldn't, say that. Of course, we should talk about statistics and things, but we should avoid sensationalism and even inaccuracy on this topic, because it's a serious enough topic by itself. And so, when we speak, and you've heard the speakers today speak about concerning rates of suicide. And then I'll just give you one other example. Lots of people say or have said unsuccessful suicide. That's something we shouldn't be saying. And the reason that is, especially with young people, I feel like we should use a language which is more positive, made an attempt. I know this is suicide and it's a difficult topic, but you'd say something like non-fatal or made an attempt on his or her life. So as professionals, I feel that we definitely have a role to play in ensuring that the language we use is fairer and more considered. And then we talk about language in families, and we talk about language in communities, and we really need that to trickle down. We really need to remove the stigma that we have in communities talking about, suicide. And we've seen from the chat already, particularly in Muslim communities, talking about suicide is so taboo, and letting people know that it's okay to talk about these issues is really important. And for me, that is the starting point. I think I had listed a few things on the chat which I found that was helpful for me. For anyone asking questions, if you're worried about someone, know the signs, find the words, and reach out. Those are the three kind of tips I would give people.
Thank you so much. And you're right, we've had a lot of questions in to do with overcoming barriers within the Muslim community, speaking about mental health, because, you know, speaking and communicating can often prevent people from taking their own lives. So an open question, and I think we'll go to you first, Sheikh Saeed. How would we kind of overcome this stigma in the Muslim community? I'm sure it's a question that everyone gets asked quite a bit. What would your advice be?
I think the first thing is when these things are discovered or people are talking about them, is to be receptive to listen. I think sometimes, you know, we don't listen to each other, and we often listen with judgment, and often we listen either to criticize or to offer solutions or to tell people or to preach to people. And the most important is listening, and subhanAllah, actively listening to someone just by being open and listening, and just not giving solutions and not offering them, you know, kind of not being shocked by what you're listening to, and reassuring the person just by being there. I think that's the first thing is really important. Secondly, I think as a community, we need to understand our emotions, and we need to start dealing with our emotions and feelings and be able to express emotions in a safe environment. Our faith encourages us to express our emotions, to talk about them. And I think the other thing as well is about all of us take a responsibility and having safe spaces where young people can come and speak about, or those of us who in the community who have mental health issues, or those in the community who are struggling or isolated. We should offer safe spaces in our masajid, in our community centers, where those people can be, you know, can come and speak to professionals in confidence, and feeling safe, feeling secure. And that's very important, you know, making people feel safe and secure by listening to them, by allowing them to express their emotions and feelings and containing that. I think that will be a good start. And then offering resources in the community. So, you know, there are a lot of community resources now that are available, whether it's counseling or help with teenagers or parenting, and all sorts of things that, you know, we can access in the community to help us to be resilient against suicide.
And what would you say to people who, we've had this question in the chat, people who are saying that prayer is the only answer to when you've got a mental health issue or a mental illness?
Prayer is one of the solutions. You know, Allah subhanahu wa ta'ala said, وَإِذَا سَأَلَكَ عِبَادِي عَنِّي فَإِنِّي قَرِيبٌ. If my servant asks you about me, I am near. So dua and prayer is important, but also Allah subhanahu wa ta'ala wants us to ask for solutions. He wants us to seek solutions that can help us. The Prophet ﷺ said, when Allah sends a disease, he sends the cure for it. So everything in the world, or every affliction, has a cure. So it's about two ways, really. It's about doing what is in your capacity, asking for help, seeking support, seeking professional help, especially, and from ethical sources and sources that are going to protect your self-interest. And then at the same time, we know that nothing can, you know, be cured except with the will of Allah subhanahu wa ta'ala. So asking Allah subhanahu wa ta'ala to assist us in our difficulty, in our situation, is also important. So those two things go hand in hand. And I think the other thing as well is about seeking trust in people, and trusting people, and being able to open up, and knowing that when you open up is the start of the solution, inshallah. When you recognize that you have a problem and you want to deal with it, and you want to seek ways and pathways of helping yourself, that will be, inshallah, start of the journey. And Allah subhanahu wa ta'ala, inshallah, will open doors for you, inshallah, on this journey, and alleviate the suffering and the pain.
Thank you. And thank you everyone who's been sending in questions. Please do keep posting them in the chat, and we've also just shared some resources that you may find useful. So we've just had one more question in. It says, thank you for the webinar, it's been very useful. I haven't been troubled with mental health, but I'd like to help tackle this issue within our community. What can I do to help? I'm going to go to you, Faeeza, first with this one.
I think for me, having conversations is key. I think we've said that a few times. Understanding the signs. So some of the signs, I know we've talked about, you know, look for signs, and of course we've said that for each person, it will be different. You will know the people closest to you best. So it's really about looking for changes to their behaviors. Of course, it will be someone talking about wanting to die or suicide also, but just a general sense of hopelessness, desperation, feeling trapped. Sometimes people give away their possessions or really important stuff. Strangely, sometimes when people are calmer and ordinarily they are erratic, that could be something that you need to look for. Sometimes people put their affairs in order, give away stuff, write a will. Of course, anger, withdrawal, anxiety, agitation, changes in sleep, sudden mood changes, just the feeling of, no sense of purpose. If you remember what I said a little while ago, it's just that suicide ends up being used as an option when if the person feels like there's nothing else that they can do. There's like no other option to them. So the first thing for me is, as a community, we need to recognize the signs. And when somebody is changing, when someone's behavior is changing, not to just ostracize them further, not to write them off as, a bad apple. That's not, I'm talking about not just in our family, but in also our communities, and to really speak to the person. And I think we had someone on the chat, Nabila, saying, speaking to someone and saying to them directly, have you had thoughts about ending your life? Asking them that question directly is important. I would also say that in our community, there is a lot of stigma when someone has died by suicide and how the family respond to that. And then that almost creates barriers and blockers to anyone else experiencing the same thing. And we really need to be more open about this. And I don't know whether Sheikh Saeed can come in on this, on how to better handle it as a community.
I think the most important is treat things with compassion. That's really important. And also when we hear rumors about things or someone passed away, we don't know the causes. Often people start going into this kind of, rumor mill and counter rumor and all stuff. And obviously that's, backbiting, and we don't know. And it's really important that we don't start kind of, being a kind of agent for spreading rumors about people. But what we should be doing is to make sure that we show compassion, we show mercy. Allah subhanahu wa ta'ala, he's the most merciful. And he said about our Prophet sallallahu alaihi wasallam, indeed we have sent you as a mercy for the whole of creation. So if we are the followers of our Prophet sallallahu alaihi wasallam, then we have to display that mercy and that kindness. And when people came to the Prophet sallallahu alaihi wasallam, when they were afflicted with mental health or with other things, he demonstrated compassion and mercy to them, and he was able to listen to them. And I think when we talk about listening, I think seek to understand before you seek to be understood. And the second thing is do not judge, because Allah subhanahu wa ta'ala is the ultimate judge. And Allah subhanahu wa ta'ala is the judge over all of us. So don't set yourself or people setting themselves, to judge and to kind of criticize and to speak about things that often they don't know the reality of. And it's very important that we when we hear something, Allah subhanahu wa ta'ala said, Ya ayyuhalladhina amanu, in ja'akum fasiqun binaba'in fatabayyanu, or you who believe, when someone comes to you with the news or something to cause mischief, make sure you clarify and you verify before you speak of anything. And sometimes we don't have to speak about anything, that it doesn't concern us, except if we have something good to say. Prophet ﷺ said, whoever believes in Allah and the Day of Judgment, let him say something of goodness or remain silent. And I think that should be our approach to these matters.
Thank you. Brother Taefur, I know you work a lot in the communities as well. What would your advice be to reducing the stigma of speaking more about mental health?
Well, I think one of the key areas Sheikh Saeed touched upon is acceptance, accepting that we do have an issue in the Muslim community and accepting mental health. Until the local Muslim communities don't accept that we are suffering from mental health issues, depending on the level of it, That's one key area. And the other area is that I say is encourage the local imams in the Friday khutbah prayers to mention mental health, to talk about mental health. And you'd find that the sheikhs will listen. If you've got a suggestion to say, they're very open, they'll listen. So I think community concerns should be addressed. And I think we all need to, not just as practitioners, I think everybody needs to, in one form or another, take charge in what's going on, because it's so if we say it's like a pandemic, and if the pandemic's not cured, it's going to spread more, and that's what's happening. So if we link that to suicide, the suicide rate amongst young men is very, very high, and we're all affected. Doesn't matter what religion, what color, what race we are, we're all affected. We're all in this together. So accepting that it's there, that's the first one, acceptance, because there's a massive stigma of even accepting that it's there. Then there's the shamefulness about talking about it. Then how does one express himself? So in the local community, his father's in the mosque, his grandfather's in the mosque, his whole family are in the mosque. So how does now one talk about these, knowing the fact in the front row that his father's sitting there, his grandfather's sitting there? So can we imagine what they're going through in these situations? Mm-hmm. So the best situation in these situations is to approach the imam and hopefully then talk about it more. That's what I say. So by talking about it, we're going to raise awareness. And the more we talk about it, the more awareness is going to be raised. So I think that's the sort of like the core issues at the moment with each communities.
Okay.
Sorry, just to add there, I think the imams and the community have come a long way since the last, I would say, even 5 years. And it's only a small minority now. And in terms of education, I think the imams need to know that they can refer out to a professional that they can will support that particular individual. So we give everything to an imam to kind of deal with and work with, then they're not going to have the time to work on their own, the masjid, or what their role is as an imam, if you like. There are, if they, what I would advise for some of these imams who are not clued up in terms of mental health is go out there and get educated in mental health concerns.
Yeah, and I think that's something that a lot of the organisations here do offer, and we'll be sharing again in the chat more information about our organisations. Brother Omer, did you want to come in on that?
Oh no, sorry. I just wanted to mention very briefly, just in support of what the others have said, that I think as communities we need to take charge of it. If we don't bring it forward as an issue, then there's plenty of other things to fill up the agenda. So I think it's really important that that's done. And as you were saying, the imam is often the pinnacle and the forefront point of the discussions. And so if he's bringing it up in Jummah, then it's more likely to come. In my experience, certainly when we've done talks in Moscow, if people approach me afterwards, they're not shy in talking about it, and there are plenty of people ready to say something, whether it's in private or in person, amongst a group, so that the issues are there and it's live. We just need to create that forum for the community to talk about it. That's how we get stigma less. It's okay to think about it. The other thing to say I wanted to add is that it is ultimately an incredibly private moment. So you may not feel comfortable. So even if your father and grandfather are in the front row, they don't even need to know about it. It's a very, very private issue, and I think it's really important that that we give someone the space to do it. And if they don't want to talk to you, that's fine. You shouldn't make them feel guilty about it. Sometimes we do that, or we make it so difficult, or we recognize it's difficult ourselves. It's easy for us to say, well, you need to pray more, brother or sister. You need to wear hijab. You need to do this. You need to do that. And that will solve the problem. I'm sorry to say that's quite a lazy response. And it's an easy one to come back to, because you don't want to listen and hear to the difficulty they're talking about. It may well be a route through. And what Sheikh Nasser was saying about it, Saeed was saying about it, is absolutely right. But it needs to be contextualized and counts for that person's individual. Otherwise, it's just another bit of advice they don't listen to. So it's really important. And the last thing I wanted to add, just there's something on the chat about ideation and plan. In effect, they're essentially the same thing, I suppose. ideation might be thinking, suicidal ideation might just be thinking about it, getting thoughts, and a plan might be more concrete. But ultimately, it's a fine line between one on the other, and it's just further along in the spectrum. So it's just really important, and getting down to plan and attempt may be very, very quick. So if people have those suicidal thoughts, it may well be a part of a normal existence, and so to speak. A lot of us may have thoughts that's just come to our head, and it's the importance and the prominence we give to them, and also what it stops us doing is when it becomes a problem. So that's when we have to recognize it. It's coming more and more to our minds. It's stopping us from doing things, going out, speaking to people, etc., etc.
Thank
Can I
you.
just add to that? Jamilla, sorry, can I just add to that? Just what Dr. Omer said, and the others. I think it's important that we kind of, when we have services or when we offer support, that is everything is confidential. And even the imams, we train the imams about confidentiality. We train the imam about mental health, build the resilience. But I think is also, it has to be a two-way thing. The imams are only there in the masjid, but often they don't have the resources. So it's also up to organizations like the organizations here today to talk to their masajid as well and establish a referral pathway, where the imam, people might be coming to him, might not have the resources, but then he has a way of referring people to, professional services and ethical services that will take care of the people who the imams are referring. So I think it's a two-way thing, because I think often, in our masajid, we focus on certain issues, but when we, as Dr. Omer said, when you do talk about these things, on Friday prayer, or, during the khutbah, or you have a study circle and you talk about mental health, it's amazing how people are ready to open up and start talking about things. So they're looking for that help. But we also need to find accessible help for them, services that are accessible, that are relevant to their needs, to their cultural needs, their religious needs, as well as, financially affordable.
Yeah. Sister Faeeza, did you want to come in on this?
Yeah, and actually the chat caught up with what I was thinking. So I think Sukaina and Sajida are both talking about kind of available resources, and there are courses, mental health first aid training courses that people can go on. There's also suicide prevention training. Anyone working, in frontline positions where you may come across vulnerable people, I would highly recommend you get yourself further trained. It's not always as straightforward. There are definitely lots of courses available which are recognized, and I would strongly advise that where possible, this training is taken up. But I do want to also touch on, sometimes we've all said that it's really important to have conversations. When you're having those conversations, I want to come back to that, because there may be, parents in the room who will never get onto a mental health first aid training course, but to really listen and to listen to what the person is saying. So they may be saying things like, I've had enough, I can't carry on, what's the point? I've done it before. All of these things can come up. And the questions that you can ask once you've listened, and we've all said, listen first, is, when did you start feeling like this? Offer them kind of self-care, practice breathing techniques, find coping mechanisms, create the space, don't stigmatize. I think I'm repeating here, but I think it's really important for us to recognize that the conversations are vitally important. And for me, the difference between someone having suicidal thoughts and, immediate need and potential danger is whether or not they have a plan. And if they have a plan, I would strongly advise you get further support, like straight away.
Thank you. And someone has put in the chat, a lot of people shy away from professional help because of the fees, and our organisations offer either free support or very low cost support. So please do have a look at all the links that have been sent. If you look at the messages by the username BIMA, that's who is sending all the links of all the organisations. Inshallah.
And I just want to echo that, there may be organizations here, and I mean, I'll speak for us first, but I know I work with other organizations who often offer concessions where necessary. So if you are struggling and you do need support, definitely ask. And and you know, inshallah, you will find help. The MWN helpline offers free counselling support. You know, we have funders who support us, and we can offer sessions free. So do get in touch with us and others.
Great.
I just wanted to add to that as well. If someone is going through suicidal thoughts and they need that support there and then, the only one that comes to mind and we recommend is a mainstream organisation who are available 24/7, which is Samaritans. And they will help you through that moment in time.
So we've got a few helplines. Samaritans is 24/7, and obviously if you are in immediate danger and you think you're going to harm yourself or others, then please do call the emergency services and get help as soon as possible.
Jamilla, I just want to, sorry, I just wanted to echo that, you know, COVID has been really difficult for many people, and we've seen the spike in mental health issues. When I looked at our stats earlier today on the MWN helpline around suicide conversations that we've had, it has gone up since last year. So this conversation is vitally important. We have to do more of this.
Yeah. Omer, did you want to come in on that?
Oh, no, I was just saying that sometimes your local mental health trust will have support lines which are open 24 hours. And the advantage of these is that they are part of the services that might run the A&Es or the local mental health support groups. So the other organizations work off either volunteers or paid individuals, but this may sometimes there may be nuanced responses, especially if you yourself or people that you know are under mental health services. They can be quite helpful because they can access notes. All the other services that have been mentioned, I think, are excellent and can support, but there's only there's a limit to what anyone can provide on the telephone, but often the result might be A&E, and for some people who sort of repeatedly go down that route might not be the best avenue. But you know, this is a generic talk. We're not talking about individual responses, and so do try lots of them. And the other thing I'd say, there's lots of links on there, and people can feel overwhelmed with links. So if you're supporting someone who's got these ideas, pick one and go through them with it. Go through to the links with them and help them through it. That might be quite useful, because there may be lots of different ways and reasons and silly reasons why they don't like the font, they don't like the website, or it's a bit slow on the mobile, whatever it is. But just find one that works, and then when you're in distress and feeling really low, you're not going to be hunting through lots of different things. You just want to do one thing, press speed dial on your phone, or go to one saved website. Yeah. That's probably the easiest thing.
And I think we'll be sharing a link where you can put in your postcode and it shows you the local services in your area as well. We've had a question in, how can we as counsellors and therapists support and work with suicidal clients in the Muslim community? Rehan, can I come to you with that, please?
I think it's going back to what we've already mentioned, and that's kind of educating the community, educating the imams, make sure that people are aware of appropriate services which they can go to. And I think it just goes back down to education, that's what I would say, within the community and the masjids and imams.
Yeah.
Jamilla, I just wanted to add, I don't know whether that question was talking about, you know, how can mainstream services also better support Muslim communities? And I think there's a strong argument for mainstream communities to allow more faith and culturally sensitive services. You know, we exist independently from mainstream services, but there's, you know, so much out there right now that mainstream services are trying to do and need to do more of in ensuring that there is space to talk about faith. And, you know, I'm sure Omer will have more on that.
No, it's just to say that in local areas where the community is large enough, then the services will be put out there. And, you know, working in a mainstream service myself, I know that there is pressure in certain groups because they are not represented for us to have some sort of response or way of reaching out to certain communities. So I think that's really useful. I've seen it in East London, where you have a Bengali they didn't call them a translator, I can't remember what they called them, but there's someone who basically worked in the team, and they'd be working alongside therapists to sort of help out on this. And in Kensington, there was an Arabic speaker in the workforce, so it wasn't just a sort of token translator, it was someone who works within the team. And that's because of the high numbers in that particular area for that service. So I think it's up for us to say there is a need here. We've got a large Muslim community. You go to any masajid, you'll see overflowing, well, not anymore, but inshallah soon, overflowing areas in Jum'ah. And so there's a large influx of people potentially. Maybe they don't live in the area, but they're part of that sort of community. And then it's for us to say to the local mental health trusts or the CCGs to say, look, there's a problem in our community. We've got high rates of mental illness or low rates of engagement with services. What can you do to help? It's within certainly their remit to reach out to our service and to access it. We can't just say, well, we're giving you appointments, sorry, you didn't turn up. We've got to think further. How can we encourage engagement? That'll come with working with the communities, working with other organizations like the ones on the panel at the moment. That's equally as important.
Yeah. So we've had quite a few questions in, just speaking generally about the webinars that we do. Just to let everyone know that we do these webinars monthly. We are a collection of mental health organisations, specifically working in the Muslim community. We do these webinars every month, and they're on different topics. And we are planning, inshallah, to set up kind of a central system for everyone to be notified about these webinars, and we will also, inshallah, they will all be uploaded onto YouTube within the next month or so. So we've come to the end of the hour of webinar. We've just got one message from Zara Mohammed from the MCB, and then I'll hand back to each of the participants who can tell everyone again about the organisations that they represent, inshallah.
Assalamu alaikum, everyone, and thank you so much, Jamilla, for the introduction. So as Jamilla said, I'm Zara Mohammed. I'm part of the executive team at the Muslim Council of Britain. I just want to thank all of our incredible guest speakers today who have highlighted such a pertinent topic, and for the attendees just to be aware that this is part of a sustained effort from our leading Muslim mental health organisations that have come together as part of the National Community Response Group, because this is part of a broader conversation, not just on mental health, but also as a community, how we not just listen, but also tackle. So this is just the start of this conversation, but I guess a response to many others. For myself, I think just really important listening to some of the advice that was given today, especially about the interplay of this topic and many other social issues that we have in our community that we are somewhat afraid to talk about. And for those who are facing such issues, how difficult it can be to have a conversation, to get advice, and to even feel confident enough to broach the subject with family and friends. So I think it's really quite incredible and important that everybody here today has offered so much good practical advice. From the MCB point of view, we understand the role that all of our affiliate member organisations have to play in this conversation, whether it be the mosque sector or professional organisations or even the charities. And I think COVID has really shown us that there's a lot we can all be doing, but most importantly that, you know, we all have a responsibility to this conversation, because sometimes we always wait till right at the end. And I know many mosques say that people come to us, they email us just at the very end of the situation when things become so critical. So I think what's really great that Jamilla and the team have done today is to say, no, let's get there before it gets to that point. So I thank you all, and just a short message of thanks from MCB. And obviously we'll continue to support this work as best we can. And thanks to everybody who's been able to make some time to attend today as well.
Thank you, Zara, for your kind words. And yes, this is something that we started up during COVID, but we will inshallah hope to continue with more webinars. Yeah, so if I would like to invite the panelists to just speak again about themselves and about the organisations that they represent. And again, if you are looking for links or resources, then please do check in the chat and the messages from BIMA, and you can find all the links and resources of places to get help, as well as the organisations represented here today. So if I go first to Sheikh Saeed, inshallah.
Jazakallah khair, Jamilla. So inshallah, you know, for all the concerns we discussed and all the issues, there are a lot of counsellors registered on the Muslim Counselor and Psychotherapist Network. If you go to the directory, there are a lot of counsellors registered there who are ethically qualified and registered and professionals who can help, inshallah. So go to the Muslim Counselor and Psychotherapist Network. Also, in terms of, we discussed a lot of things about parenting, about teenagers, about, you know, postnatal depression, although we haven't touched about it today, but is one of the factors. So, you know, approachable parenting also do a lot of excellent work in this field about parenting, postnatal, prenatal support for women, for young people, for children and teenagers. So please, you know, go to their website at approachableparenting.org as well and access support. There's support available and there's help available, and there are a lot of courses and things that you can access, inshallah. So the main thing, if you're struggling, please do not struggle alone. There are a lot of services, there is a lot of help, and inshallah, we ask Allah subhanahu wa ta'ala to make it easy for everyone and to alleviate the suffering of our brothers and sisters who are suffering and struggling. And we ask Allah subhanahu wa ta'ala to open doors for them and inshallah alleviate their hardship.
And Sister Faeeza?
So I'm Faeeza Vaid. The Muslim Women's Network helpline is open Monday to Friday, 10 till 4 p.m. We do have options for counselling referrals, or if you just want someone to talk to, you can contact us on a range of issues, not just mental health issues, which is usually helpful. So I would say echo what Sheikh Saeed and other speakers have said. Reach out, support is available, and if you come to one of us and we can't help you, we will certainly signpost you to someone who can.
Yeah, Brother Rehan.
Yeah, as I mentioned earlier, my name is Rehan. I work for Sakoon Counselling Services. We offer couple therapy, family therapy, individual therapy, nationally and internationally. I think what's more important is what people have mentioned today, which is education to the community. We have been providing education to Muslim chaplains, imams, some which have gone on to do accredited training courses. In terms of what we discussed today, which was imams, which should be and stigma, I think very early on when there was a very bad reputation, if you like, imam, say about 6-7 years ago, come fast forward to today, the reputation of imam is increasing, and which we aim to kind of increase as well through education. Okay.
Thank you.
So yeah, my name is Taefur and I represent Mindworks UK. Mindworks is a faith-based counselling service, and we provide counselling service for all different backgrounds or different nationality.
Thank you. And lastly, Dr. Omer.
Assalamu alaikum. Jazakallah for asking me to do that. I should have mentioned at the start that I represent the BIMA, which is the British Islamic Medical Association, which is an independent, non-for-profit organisation for Muslim healthcare professionals. So we offer support and highlight some of the work that they're doing, and also for anyone. I think there's plenty of really good work on the website. So if you are interested or worried about particular healthcare questions and wanting an Islamic perspective from it, we've got well-researched views and opinions on that, which are often seen as well balanced. So that's worthwhile having a look at. So that's britishima.org. Just as a final point, to say jazakallah for all the speakers who added excellent points, and I hope that we can help and improve our local communities, spearheaded through the imams or the local committees. Sometimes that's more important in certain masajid or organisations, worthwhile putting that in, and also social media can be quite helpful. I think in the era that we've seen the proliferation of it, especially when people are in lockdown. It can be either a positive or a negative. I don't think one can be absolutist about it. And there is growing evidence about its link with mental illness or suicidality. Not to say that it increases or decreases, but it's just really around where or how, what methods people use to access information. So that's probably the important aspect, and sort of watch this space. Not literally this, because the link will close, I'm sure.
That's great. Thank you. Thank you, all the panelists, for joining today, and thank you everyone for attending. Again, if you are looking for resources to help, please do look in the chat at those that have been posted. There's been a lot of links, a lot of resources. Sister Faeeza has just posted another resource. And please do continue to talk about mental health. Thank you again for joining, and I hope everyone has a lovely week, inshallah. Assalamu alaikum.
No,
Islam.